it's Jenny D and Health Tidbits with Dr. Kohli. Cherry Creek Heart is her practice, accepting new patients. You also probably see her as an expert on 9 News. So, Dr. Kohli, today we want to talk about alcohol reducing a feeling of loneliness. Is that actually true?
It is true, Jenny. And here's what the science tells us. When we consume alcohol, it actually turns off the front part of our brain called the prefrontal cortex, which is associated with anxiety and social anxiety, feelings of self-doubt, what have you. It also increases release of the feel-good hormones like endorphins and dopamine. So when we take a slug of alcohol, not only do we feel better, we feel less sort of anxious and less lonely. And if you look at people who consume alcohol, in that moment, they describe a feeling of more connectedness with others.
And so can alcohol use make loneliness worse over time, though? Because I know it's that instantaneous feeling better, but over time, does that get to be too much?
It does. And this is the kicker here. And so a lot of people medicate using alcohol for loneliness, for stress, for anxiety, because in that moment it makes you feel better. But the next day you actually have what's called a rebound effect, where things actually get worse. And then guess what you do? You reach for more alcohol. And so now you're caught in a spiral. And every day you get a little more rebound. So things actually get a little bit worse. So I really don't want people to start to think about alcohol as a tonic, as a feel-good tonic. Because unfortunately in our society, it has become that. It's a social lubricant, as Dr. Oz likes to call it. You know, it's a way for people to get together. It's a way for you to blow off steam after work. And it's called a happy hour, which automatically associates it with feelings of
happy,
feeling good, right? Yeah, but that's really not how it's working in our brain. So over time, it actually does the opposite. It makes feelings of anxiety, stress, loneliness, and social isolation worse. It obviously puts stress on our relationships if we're consuming excess alcohol, not to mention all the physical risks of the alcohol as well.
And I was reading this, and I know you and I have talked about it a little bit. Americans have been drinking less, especially the younger generations,
Yes.
which, I mean, growing up, it was always there. Our parents were always drinking. Like, I feel like the younger generation is getting a little smarter about that.
They really are. And I think that message has started to resonate, that alcohol, no amount of alcohol is good for you. In fact, the science is very clear on this. The more alcohol you consume, the more likely you are to have an alcohol-related death, an alcohol-related complication, or alcohol-related chronic illness. And so the World Health Organization has really put their nickel down on this and said, do not use any alcohol, because alcohol causes risk. Others have said, including the American Cancer Society, that if you are going to use alcohol, really try to keep your weekly consumption less than 2 drinks a week, because you really see an inflection point where the risk starts to go up. Now, this is a big change from where we were before, because the American Heart Association, the CDC, and others had said,
like a glass of wine a day.
Yeah. Right? 1 to 2 drinks a day should be okay for most Americans. That's considered moderate consumption, but not anymore. The last couple of years have really seen a shift away from that. So now we're essentially saying less than 2 a week, but none is, the best. And if you are going to drink, you really want to make sure you're not binging on the alcohol, because that could be the worst.
So being like a weekend warrior.
That's what I'm talking about.
Like having so if you do have your 2 drinks, don't have them in the same day.
Try not to. Because it's a dose of alcohol, space it out. So I have patients who say, I only drink Dr. Kohli on the weekends. But how much do you drink? Well, I drink 4 on Saturdays and 4 on Fridays. That's worse than drinking 1 drink a day during the week, because then you're giving your liver a lower dose of alcohol to detox and metabolize. And so essentially it's a carcinogen, it's a toxin, and your body has to try to get rid of it. But you're spacing out how much toxin you're giving so that the dose in your bloodstream is a bit lower. So I would rather you not drink at all. But if you are going to drink, a half a glass to a glass a day is probably a better way to consume alcohol than to have 4 on Friday and 4 on Saturday.
Yeah. And, sorry.
You're good.
It's all the spam calls. This is the stress we were talking about a few minutes ago. So there's a new study that came out about heavy alcohol use in cancer that looks at something called lifetime exposure. What's that? Talk about that.
So, we've been talking a lot about alcohol. We say, how many drinks a week? But we don't talk about over the course of your life. How many have you had on average, right? And so this is what's called lifetime exposure, which means it's not just how many did you have when you were in college and you were a party animal or whatever. Not me, I was the boring one. But my roommate was a party animal.
I was going to say, I was not boring. No.
So then we talk about lifetime exposure. Okay, so if early in your life you had a large exposure to alcohol, and they're talking essentially more than 14 drinks a week is what they considered a heavy use of alcohol, they looked at your risk of cancer. Because again, alcohol comes into contact contact with your entire GI tract, and it's a carcinogen, and it's linked to 7 different types of cancer. And what they found was a 25% increased risk of colon cancer and a 95% increased lifetime risk of rectal cancer.
Oh, wow.
Yeah. And so to me, the message is now, just like it's resonating with the younger population, it's never too late to cut down or to quit. And if you haven't started, don't start. The glass of wine a day keeps the doctor away. You know, especially as a cardiologist, it's good for your heart. No, it's not good for your heart.
Try
It's
an
bad.
apple instead.
Try an apple instead. I like that one. Yeah. But I really want us to start being mindful of our alcohol consumption because it's such a cultural part of our society. That
And I think COVID made a lot of things worse too for that because,
Right.
and maybe that's when you were talking about the loneliness.
Yes.
And that's something where I think we're seeing now the effects of that on a lot of people, like, you know, trying to figure out how to have that connection without the alcohol that they used so much during the
Right,
time.
and we've sort of become, it's integrated into our culture. Now, let's say we stigmatized it like we stigmatized tobacco, right? When somebody's smoking, you're, oh my gosh, like we don't smoke on planes anymore.
Yeah.
But of course, everyone's having drinks on planes.
Yeah.
You know? So I think we really need a cultural shift where we're getting together socially for exercise, for activities, for, you know, like some kind of craft project, for doing things that increase togetherness and bonding, but without necessarily the alcohol.
Well, awesome. So Dr. Kohli, you can check her out at Cherry Creek Heart. And of course, you'll see her on 9 News as well. Thank you, Dr. Kohli.
Thank you.